Assalamualaikum and a very good day. My name is ALYA SABIRA and I would like to present the findings of my study entitled Prevalence and Risk Factor of Latent Tuberculosis Infection in Malaysia as detected by QuantiFERON TB Gold Plus. I start first with the introduction. Tuberculosis, which is a disease of public health importance in Malaysia, with the incidence of TB currently is estimated to be 92 cases in every 100,000 population. Latent TB infection cases among Malaysians are another great health concerns that require immediate steps to be taken to detect, diagnose, and treat LTBI as one of the key strategies to end TB. Although individuals with LTBI are unlikely to infect others, the threat of the infection is still imminent as these individuals can potentially develop into active TB. As such, this study aims to identify the prevalence of latent TB in Malaysia through a more sensitive detection method, QuantiFERON TB Gold Plus, and to determine the association between the risk factor and LTBI cases. This study involves the retrospective data by analyzing the archive records of 3,877 patients attending Pantai Hospital Kuala Lumpur from January 2021 to March 2022. The cases underwent QuantiFERON TB Gold Plus test for LTBI at Pantai Premier Pathology Laboratories. Let's move on to the results that we found using the use of newly introduced generation of interferon gamma release assay, QuantiFERON TB Gold Plus. From the total of 3,877 patients who have been suspected to have LTBI, there were 16.46% with LTBI positive, while the majority of the cases were negative LTBI with 73.59%. However, there were 9.96% with indeterminate results identified according to the test. Based on the socio-demographic factor, by using the descriptive analysis, males contributed to the 53.76% by having LTBI positive, while the majority of the cases were between 30 to 43 years old with 30.88%. And Chinese ethnicity with 35.27% had higher risk of having LTBI. For the second objective, the binary logistic regression was used to predict the outcomes of the LTBI cases with the risk factor of socio-demographic. Age and ethnicity were found to have a significant difference in determining the LTBI cases for negative and positive results. This means that age and ethnicity could predict the LTBI cases in determining the possibility of an individual having LTBI or not. Based on the previous studies, age is always associated as a risk factor for positive LTBI tests, especially in communities as increasing age. Meanwhile, the risk factor of ethnicity may be related to the lifestyle, habits, and diet that determine the susceptibility towards TB infection. In a nutshell, the prevalence of LTBI in Malaysia was remarkably low for an intermediate TB burden country. Age and ethnicity are the associated risk factor significantly with LTBI cases. Although LTBI is not contagious, screening and treatment of people with LTBI is part of the current healthcare intervention for TB prevention. Specific clinical and preventative consideration are needed for the diagnosis, treatment, and implementation of appropriate safety measures to curb the spread of the TB in Malaysia. This is my references. That's all from me. Thank you.